start. This is MoribundMurdoch Medical Reads or whatnot. Maybe there'll be some fancy phrasing in that I find humorous or whatnot. Episode Uno's Deep Brain Stimulation. Deep Brain Stimulation, DBS, is a neurological procedure introduced in 1987 involving the implantation of a medical device called a neurotransmitter, sometimes referred to as a brain pacemaker, which sends electrical impulses through implanted electrodes to specific targets in the brain nuclei, for the treatment of movement and psychiatric disorders. DBS in select brain regions has provided therapeutic benefits for likewise for otherwise treatment-resistant disorders such as Parkinson's disease, essential tremor, dystonia, chronic pain, major depression, and obsessive-compulsive disorder, OCD. Despite the long history of DBS, its underlying principles and mechanisms are still not clear. DBS directly changes brain activity in a controlled manner. Its effects are reversible, unlike those of lesioning techniques, and it is one of only a few neurosurgical methods that allow blinded studies. The Food and Drug Administration, FDA, approved DBS as a treatment for essential tremor and Parkinson's disease in 1997, dystonia in 2003, and OCD in 2009. DBS is also used in research studies to treat chronic pain, PTSD, and has been used to treat various affective disorders, including major depression. None of these applications of DBS have yet been FDA approved, while DBS has proven to be effective for some patients' potential for serious complications and side effects. Components and placement. The deep brain. Ooh, this is going to be too big. Alright. Mini-me. And border-me. Pop up there. No, pop up here. You're there now. I'm tiny. Parkinson's disease. Parkinson's disease is a neurodegenerative disease whose primary symptoms are tremor, rigidity, and bradykinesia, and postural instability. DBS does not cure Parkinson's, but it can help manage some of its symptoms, subsequently improve the patient's quality of life. At present, the procedure is used only for patients whose symptoms cannot be adequately controlled with medications, or whose medications have severe side effects, or you have a doctor with a very awesome personality. Its direct effect on the physiology of brain cells and neurotransmitters is currently debated, but by sending high-frequency electrical impulses into specific areas of the brain, it can mitigate symptoms and directly diminish the side effects induced by Parkinson's medications, allowing a decrease in medications or making medication regimen more tolerable. There are few sites in the brain that can be targeted to achieve differing results, so each patient must be assessed individually, and a site will be chosen based on their needs. Traditionally, the two most common sites are the subthalamic nucleus, STN, and the globus pallidos Antonia GPI, but other sites such as the Claudio Zona Incerta and the Pallidofogo fibers medial to the STN are being evaluated and show promise. In the United States, DBS, approved by the Food and Drug Administration for the treatment of Parkinson's, DBS carries the risks of major surgery with a complication rate related to the experience of the surgical team. The major complications include hemorrhage 1 through 2% and infection 3 through 5%. Stimulation of the periapical gray and the periventricular gray for non-irreceptive pain, and the internal capsule, ventral posterolateral nucleus, and the ventral posterior medial nucleus for neuropathic pain has produced impressive results with some patients, but vary. And appropriate patient selection is important. One study of 17 patients with intractable cancer pain found that 13 were virtually pain-free, and only 4 required opioid analgesics. Pain-free on release from hospital after the intervention. Most ultimately did resort to opioids, usually in the last few weeks of life. DBS has also been applied for phantom limb pain, major depressants. I got this. Narration practice. Major depression and obsessive-compulsive disorder. Deep brain stimulation has been used in a small number in particular, of clinical trials to treat patients suffering from severe form of treatment-resistant depression, TRD. A number of neuroanatomical targets have been utilized for deep brain stimulation for TRD, including the subgenual cingulate gyrus, posterior gyrus rectus, nucleus accumbens, ventral capsule, ventral striatum, inferior thalamic peduncle, and the lateral hypernula. A recently proposed target of DBS intervention in depression is the subrolateral branch of the medial forebrain bundle. SIMFB is stimulation led to surprisingly rapid antidepressant effects in very treatment-resistant patients. The small patient numbers in the early trials of deep brain stimulation for TRD currently limit the selection of an optimal neuroanatomical target. There is insufficient evidence to support DBS as a therapeutic modality for depression. However, the procedure may be an effective treatment modality in the future. In fact, beneficial results have been documented in the neurosurgical literature, including a few instances in which deeply depressed patients were provided with portable stimulators for self-treatment. A systematic, let's get all the s out of there. A systematic review of DBS for treatment-resistant depression and obsessive-compulsive disorder identified 23 cases, 29 for OCD, 7 for treatment-resistant depression, and 1 for both. It was found that about half the patients did show dramatic improvement, and the adverse effects were generally trivial. given the younger psychiatric patient population than with movement disorder. The first randomized controlled study of DBS for the treatment of treatment-resistant depression targeting the ventral striatum area did not demonstrate a significant difference in response rates between the active and sham groups at the end of a 16-week study. DBS for treatment-resistant depression can be as effective as antidepressants. Yeah, okay. With good response and remission rates, but adverse effects safely must be more fully evaluated. Common side effects include wound infection, perioperative headache, and worsening/irritable mood. #Kodak and increased suicidality. Tourette syndrome. Oh, how much time do I have? Pooh, yeah, I'm not allowed to read this much. Yeah, you gotta stop. I gotta do it in 2 parts. For now. Do 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 do